'Tis the season for Medicare enrollment, but don't let the process get you down. Here to make the decision easier in this sponsored interview is Roger Reese with United Healthcare. Hi, Roger.
Hi.
All right, so I'm hearing my parents talk a lot about this right now. I think that they're the age. What age are we typically discussing when it's a Medicare conversation?
Typically, it's at age 65, but there are some exceptions to that. If a person becomes disabled, they may qualify before age 65.
So something to look into, absolutely, because it is here to help you. I feel like no matter who you are, you have questions at this time of year. Maybe your circumstances have been changing and you have some new questions. It's a little bit of an intimidating process. Talk us through.
Yeah, it can seem complicated, it can seem overwhelming, but that's why we're here. I've brought in some agents with a lot of experience. Every year they're reviewing the plans, and they're here to help people navigate that process. The changes are there every year. In terms of the plan, your health needs, those are going to change. We do have some recommendations every year. We got 3 broad categories. You're going to want to check your providers, your doctors, your specialists, your primary care physicians, hospitals, clinics. Make sure they're still in network, or the ones that you want to see, or you may be expecting to see. You're going to want to check that. The benefits, I talked a little bit about that before in the other segment. It's vision, it's hearing, it's over-the-counter items, in some cases healthy food. You want to make sure that those are fitting your lifestyle. And then lastly, very important, is prescription drugs. Those are going to change not only the drugs that you take, but also what the plan covers and maybe even the cost of those. And so every year it makes sense to review with a licensed professional agent that really understands the plans and works well with, this is what they do, day in and day out.
Yeah.
It's helping people and serving those people.
Well, that's crucial advice because things do change when it comes to a location. Some hospitals now at maximum capacity, or you mentioned out of network.
Right. That can change, and sometimes you may have missed that. If the notice that was sent in the mail, and so these individuals, they know the plan, they know the landscape, they know, and they're able to speak to that and find out where you're at and try to find a plan that makes the most sense for you.
Yeah, you need a good agent sometimes just to talk you through, because they're talking about the different plans. $0 co-pays, is that really something that we can look at?
Yeah, that is very common. $0 co-pays to see a primary care physician, for many generic drugs. There's a $0 copay to even go to the fitness benefit, go to a gym. There are multiple gyms, no cost to you. We've got something called a U card that makes it really easy. You use that same card whether you're going to the doctor, whether you're going to the dentist, whether you're going to the gym. Makes it really easy. And yeah, we work very hard to try to lower those costs for the people we serve.
A lot of details there, and they will help navigate you through. Let's touch on those dual special needs plans and details one more time.
Sure. Now, a dual special needs plan is a type of Medicare Advantage plan that's available for people who have both Medicare and Medicaid. It's designed to provide those extra benefits that are not available through Medicare and Medicaid. There's lots of benefits. There's allowance for hearing aid coverage. There's an allowance for glasses. There's, I mentioned before, there's the fitness benefit. Probably one of the most popular ones with that particular plan is an allowance that lets you either use it for over-the-counter items, or for healthy food, or for your utility bills. When you think about that makes a big difference.
Yeah.
You have a fair amount of money that's going to be used in the way that you need it the most, whether it be going to the grocery store, a local grocery store, buying that healthy food, or maybe you need a little help paying that utility bill. That's all built into that plan. So with all those benefits, it makes sense to call, see if you qualify, and if so, if it's a good fit for you.
Well, that is huge. And with those details to work through, don't try to stumble through this by yourself. Let the agents be your guide. Call them right now. Take advantage of this. The best way is to call 801-975-4400 and speak to an agent standing by now. Or if you want to hop online, go to shopuhc.com for more. And now's the time. It's that time of year.
It is that time of year.
Thank you so much for all of the great information and for bringing in your agents to help.
Yeah, absolutely.
Thanks to United Healthcare for this sponsored interview.